Good afternoon, everyone. Welcome to the Using Recovery Coaches in Substance Use Disorder Treatment webinar. We're glad you're joining us today. This webinar is being recorded, and if you would like to view captions for this event, there's a URL in the chat box you can click on, and you will see captions for all the words being said. I just wanted to tell you a little bit about some of the information that we're going to present to you today. You're going to learn how the recovery coaching program that is active here at UMass Memorial Hospital works. You're going to learn about how the program was developed, how it started with a grant. You're going to learn a little bit about how our recovery coaches who are presenting today, how they became recovery coaches, the training that they took. You're going to learn about their part of being a part of a care team, and maybe a little bit about what a typical day is like for them. We'll also be talking about motivational interviewing and why this type of communication helps with establishing relationships. And then lastly, they'll talk a little bit about some data they have collected about recovery coaching being a successful part of a treatment plan for substance use disorder. I'm your host, Susan Halpin. I'm the Education and Outreach Coordinator for the New England region of the National Network of Libraries of Medicine. My office is located at the University of Massachusetts Medical School in Worcester, Massachusetts. As I said, this webinar is being recorded. In a week or so, you will receive a link to the recording and the presentation slides from this webinar. So Rich and Rob are going to present for about 40 to 45 minutes. During that time, if you have questions about anything you're hearing or seeing, jot those questions down, and then we'll save the last 10 to 15 minutes as an opportunity for you guys to ask questions, and you'll be doing that in the chat box. So I noticed that there were some people who registered for this webinar who may not be familiar with the National Library of Medicine. So I just want to take a couple of minutes to explain who we are and what we do. So the National Library of Medicine, or NLM for short, is a physical library, and that's a picture of it in this slide. It's located on the campus of the National Institute of Health, which is in Bethesda, Maryland. And the NLM is the largest biomedical library in the world and one of the federal government's largest providers of digital content. So all of the NLM's information has been put online, and anyone can access this health and medical information. The mission of the NLM is to advance the progress of medicine and improve public health by making health and medical information accessible to everyone. So the NLM carries out its mission through a national network that has about 7,000 members across the United States. Anyone can become a member, and these network members are, they come from all different professions and walks of life. They're librarians, they're healthcare providers, they're public health professionals, educators, students, researchers, first responders, and even people who, from the general public who are interested in health and medical information. anyone can join this network and receive information about the training classes we offer. Last year, our network trained about 77,000 people. This slide is just a picture of a listing with links of the extensive amount of information about substance use disorder that NLM has available that anyone can access. So there's a lot of information about the prevention and treatment of substance use disorder, and this information is aimed at several or many different what do I want to say? It's grouped by information for public health people, for educators, for students. So anyway, you will receive this listing when you receive, it'll be available with the recording link and the slides from this webinar. And the last thing that I wanted to bring your attention to is another resource that's fairly new to, or fairly new that the NLM makes available, and it's our graphic medicine book club kits. So if you provide programming for teens or adults and you're located in New England, you are eligible to borrow this book club kit and use it as a programming tool. So these kits are mailed out to you free of charge. They include 6 copies of a graphic novel, and for those of you not familiar with what graphic novels are, they're books that are written in comic book format. So having both the pictures and words is very helpful to convey ideas when reading about topics that may be difficult emotionally. The book club kit also includes health and medical information from NLM about the topic of the book, as well as discussion questions you can use. All of the information you need to learn about the graphic novel book club kit is included on this slide, so you can look at that if you're interested more later. All right. And now I'm going to turn this presentation over to Rob Ryan and Rich Kenny, who are our recovery coaches, and they'll be giving you the information you came for. Take it away.
Awesome. Thank you very much, Susan. Primary reason for even doing this is because I just love that sobriety book so much. No, recovery coaching is all about building relationships. So one of the biggest takeaways for me today, my name is Rich Kenny. I'm a certified addiction recovery coach at UMass Memorial. Biggest takeaway here for me today is meeting Susan and being blessed, if nothing else, to spread the message and disseminate this and be vocal and visible about recovery, and especially recovery coaching. People with lived experience that can be effective. And I will now turn this over to my recovery coach supervisor, Robert Ryan, and friend and fellow lived experience.
Hi, how you doing? So yeah, this is Robert Ryan, recovery coach at UMass Hospital and recovery coach supervisor. Thank you, Susan, for this opportunity to do this webinar, and thank you to the U.S. National Library of Medicine to give us a voice and talk about our experience here with the hospital and being a recovery coach, and the opportunity to have a position like this, which is so great, and I'm so thankful for it. So let me jump right into it. So I'm a person with lived experience in recovery, the foundation for the position. And I've been working here at UMass Hospital for about 2 years. And like I said, I'm extremely thankful for the opportunity here at UMass. My credentialing up here is to give a little insight about what's been going on with me on my journey to have this career in recovery coaching. and to pursue other positions in substance use treatment. So, like I said, been here for 2 years. Precursors to this is working with young adults in the young adult program in Framingham. Shout out to Yarcum, funded through SMOC. Lots of thanks to them and that program. Great young adult program. And I also wanted to throw in there just a little bit of the certificates I have and clinical training, my LADAC pending, which really has nothing to do with the position I have right now, but a shout out to Mass Rehab and other organizations that provide any money or funding towards people like me with lived experience in recovery getting on the path of working in this field. I am not a well-to-doer, and any help that I've received during my journey to do something I love is great and greatly appreciated. And some other trainings that fall in line with recovery coaching in general. So, Rich.
Awesome, thanks, Rob. Yeah, Rob's my leader here. I'm really happy to be kind of on both sides of the coin, if you will, with Rob. And I know him from some other venues, but we'll stay on topic. My name is Richard Kenny. I am a recovery coach here at UMass Memorial. Been employed since April 10th, 2017. I, like Rob, am also, many people in recovery, we talk about this gratitude, like conceptually, but I truly am very, very grateful to. I was at the right place at the right time. I kind of deemed this phrase, coined it, called two-sided lived experience. Anecdotally, I call it that because a lot of times you just hear people say, oh, I have lived experience. And being in recovery, I definitely knew how to do drugs, and I was very good at, effectively getting myself in an altered state. But I also want to talk, like Rob so beautifully talked about, was how he got here and what he does now on the other side and working in the field. So I've put it this way. That's a fun little picture of me in the middle, led by me, Rob, and our coworker, Teresa Phelan, and formerly Alyssa Renaud. We put together what you're seeing there is the International Overdose Awareness Day. Aside from recovery coaching, one other way that the hospital has been so helpful in proliferating the message of recovery coaching was also to recognize, as the coach and the staff, along with the Overdose Prevention Fund, some people put together the flag event. And so we're very happy about that. So outside of recovery, you see here that I bulleted that outside of this recovery process, I'm a drug user, I'm inside jails, hospitals, and courtrooms. Inside recovery, like I said, I kind of flipped the script here, I'm outside of jail. It's nice to be outside of jail. So I completed the Channing program, and I also just wanted to make note that one of the earliest sign of this lived experience and valuing other people's lived experience is really cool because I can actually speak, like Rob did about Yarcum, I can say that a social model program is not unlike peer support in that it's each one, it's predictable, it's compatible with one another, that the people who are recovering in these residential treatment programs, they're kind of like the residents run the house. So again, that's in many ways, that's just kind of like the experience of being a recovery coach and helping someone who too has substance use disorder. I also too employed here, CADC pending. I went to the ACE program. I want to give a shout out to AdCare and also to Mass Rehab, one of my own recoverees who wanted to come after having success here at the hospital. He wanted to become I didn't realize this, Rob, that some of this funding's not available now. So I really want to give a huge thanks for the fact that my education there was paid in full and I was able to receive the monies from Mass Rehab. I also am a homeowner and a father, like I said, and a happy husband who's been married a little over a year.
Can you explain what the initials mean?
Yeah, absolutely, Susan. So a CADC is nationally recognized, a little different from the Massachusetts program specifically that Rob was signed up for, but CADC is Certified Alcohol and Drug Counselor. That, again, I have taken all the necessary requirements and completed the practicum, but I am CADC, like Rob said, I have the certificate. I'm yet to take the test, confident that I'll pass with flying colors when the time comes. And I recently have become Massachusetts recognized certified addiction recovery coach. And so that's what the CARC is. One of my favorite things to do is really spread the message that, as this thing really gets some traction and we build up speed, it's good for people to know that there are certifications and that we are working very hard to professionalize the recovery coach field. Moving forward, Rob, would you like to kind of tell?
Yeah, so thank you, Rich. Again, a huge shout out to any kind of funding we can get to have these positions. So the development of the Recovery Coach program, part of a consultation service supported by 2 rounds of infrastructure and capacity building grants from the Commonwealth. So initially we started in this position with 3-4 recovery coaches, an addictions social worker, and addiction psychiatrist working in the hospital. And from that grant, we expanded to second grants to support it, telemedicine, which was a huge innovation to go cross campuses and reach more people and work with that and have a taste of technology. Rich will touch on that later about working with that. He more so did the telemedicine. Program is sustained now, direct funding from the hospital, also new grant that we're working on, Health Policy Commission, bringing Medicaid-assisted treatment initiation into the emergency room. So for the several years, we've been primarily admitted patients on the hospital floors, and we'll go more into that later. But we get all sorts of requests all over the hospital. I've been in the emergency room prior to the upcoming grant, but a lot of services and work on developing a bridge clinic to help connect patients just coming into the ED, getting connected with Medicaid-assisted treatment, and connected with us to work with them in the recovery after a emergency room stay.
So a recovery coach, a lot of people it's a very curious question, and you hear a lot of explanations. This is kind of just a grassroots kind of, not bare bones, but basically just the gist of what a recovery coach is. And it's also notable to make the distinction of what a recovery coach is not. Blessed to call a man named Jim Wolfing my friend, but he's also was instrumental in helping write the Recovery Coach program on the strength of what's known as the William White Papers. Very influential in all peer work being done now, especially with CARC and as well as the Connecticut CART. And so a recovery coach, like I mentioned earlier, is a professional. It can be paid or volunteer, but currently I'm compensated for my work done here, as well as Rob and the whole team. It's also a person who engages someone who wants to get into treatment. One of our primary things we do here and aligned with Massachusetts is that we're looking at, we have a recovery coach initial contact note that includes stage of change, the stage of change model, seeing where people are at. And here in the hospital, we will go into great detail, but the focus is on typically non-clinical issues. Sometimes people often ask, like, how is it that you're recovery coaching here at the hospital? But I think it's, we've proven that it's absolutely necessary. Now, sometimes I like to say that it's not impossible, but in some respects, you're definitely like surfing the lines. But again, as peers and people with experiential knowledge, we're able to do that successfully here in the hospital. And other things that they do outside of the scope of our own work, Rob can talk about that a little more, but also they do help with housing, employment, and
drug courts, of course. And so yeah, this is just broad recovery coaches besides hospitals or any level of engagement or intervention. We are people to make a connection with someone, and through our lived experience try to help motivate recovery, help with recovery planning, and remove barriers to help with that recovery. So that's basically sums it up for wherever you are. Drug courts, rolling with police forces, hospital settings, discharge after incarceration, participating in medication at some form of a clinic or access to recovery format. So, yeah, basically sums it up.
Yeah, thank you, Rob. I just want to really just one more time reemphasize the fact that a lot of our job is spent telling people also things we're not doing. A lot of times from having an experience of being in detoxes, hospitals, jails, I'm always assuming the person coming in, they're either a guy from AA or, you know, are you my sponsor? And I just want to say that one of the things you learn at the Academy is that you're not a drug counselor, even though Rob and I respectfully did attend this schooling. The difference is that we're able to self-disclose, and not only is it not frowned upon, it's actually encouraged as an immediate jumping-off point of establishing rapport. We're not clergy, nurses. We do wear many hats, and especially in our job here, but we are also, especially working with a doctor, we're not making med recommendations, although we do sometimes give treatment options in paperwork as far as, you know, what people's options are, and acting as a go-between between us and our own doctor. So moving forward, we're going to touch on MI a little bit today. I have to be honest, we did scale back a little bit on the MI. Anybody listening today, I hope you're not too disappointed, but I will say this person-client recovery centered discipline is something that it's an art form, and we do want to give credit where credit's due. Our coworker,
John Monfredo, he provided these slides. He's a great guy, great social worker.
So again, just like with the coaching, making a couple distinctions of motivational interviewing, this was something developed by Miller and Rolnick. Anybody listening probably has a little bit of an idea. The aptitude for MI is used in many venues, the business world, the sales world, other forms of treatments, therapies. So what it is it's collaborative, it's person-centered. In our case, it's the coachee or recovery-centered. It's respectful. It definitely honors the person. It's problem-solving, and most importantly, I would submit, is that it's evidence-based. And what it isn't is it's not authoritarian, so we're never, you know, we're not on a kind of a hilltop. We're looking down on people, which can so often be kind of the model. As much as doctors probably may not, that may not be the intent, especially with this difficult, sometimes tricky population that I'm proud to be a part of. It can feel definitely like an unevenness, wouldn't you say, Rob?
Yes, definitely. Some culture in that, depending on, you know, who's approaching what patient. But yeah, MI, like Rich said, a huge shout out to this tool to represent approaching patients and getting everyone's needs met to talk to the patient. And it is not a Jedi mind trick.
We've got a quote here from Star Wars. It says, "These are not the droids you are looking for." Again, we want to give John much respect for the fact that he's just a big fan of literary and many cultural and pop icons and stuff like that. So how to evoke change talk? We have many different tools here. In front of me, what you guys aren't able to see, we have recovery coaching supporting tools and different things that kind of map out pretty simply about, you know, this evoking change talk, one of them being important scaling. Oftentimes it's a simple readiness ruler on a scale of 1 to 10. How important it is, what is your level of commitment, your readiness, how, and this way people kind of, you see where they're at, and then you can kind of also elaborate and go further with that. It explores the goals and values of that person. Again, the biggest thing for the recovery coaching piece here that I guess, you know, you either do or don't learn in a very short academy, but more so having experience with people and talking and really, you know, the peer element embraces the wounded healer. We know, again, as Rob mentioned earlier, the lived experience of people, and it really honors them. It also asks open-ended questions, and it also uses extremes. On this end, on the far end of the spectrum, where are you headed? And again, like looking back and then looking forward, where do you want to be? And most importantly, again, it's all about positive and negatives of the target behavior, and not trying to change people or fix people, but kind of get a feel for where they're at by asking good questions. And most importantly, I remember the Academy taught me, this is really difficult for me, Rob, is the 2-to-1 ratio. Definitely want to be slow to speak and quick to listen. And the core skills utilized here, again, I don't want to assume that anybody listening knows this automatically, but I think if you've ever seen anything on MI, you certainly couldn't go without seeing this acronym, OARS. The core skills are open-ended questions, affirmations, reflections, and summaries. Yeah, Rob, you want to read off that first one there for me?
Yeah, so open-ended questions here, not easily answered yes or no responses, and we touched a little bit on this yesterday, and in regarding to MI or overall approaching patients in the hospital setting, first of all, we're going to touch on many things and jump back and forth, but a lot of patients that are in the hospital admitted were probably not seeking substance use treatment. They were presented to the hospital for a medical complication. So a lot of people we will initially approach have a sense of pre-contemplation, contemplation, and you really have to talk to someone to know their background. So when I'm approaching a patient, you know, they've been asked all sorts of questions by doctors trying to assess their substance use. And of course, it's very easy to come to a conclusion that someone's substance use brings them to risk. Using opiates in any form recreationally is dangerous. Drinking certain amounts of alcohol, yes, you know, 6 beers a day, this often is too much. But when I'm approaching a patient, I don't want to ask those questions. The questions I'm more interested about is what's their experience with treatment and exposure to sobriety, periods of sobriety. So I will more so, you know, of course I need a background and understanding of what their substance use is, but, you know, the best open-ended questions for me that do not have yes or no responses is them themselves talking about their experiences with recovery, if they've ever been in recovery, if they've ever had any periods of sobriety, what has worked, what hasn't worked, and to really build from that. I can tell what someone needs a lot more off of their experience in recovery compared to their daily intake. So just a little tip right there.
Yeah, thank you for that primer, Rob, on open-ended questions and kind of just sort of getting to the heart of the matter. And I think it's also important to remind, even though you don't see it on the slide, I think that one of the best parts about being a recovery coach and getting kind of a unique understanding of many of the people we see is that it's really, it's present and it's future-oriented. Unlike a substance abuse counselor or a therapist, we're not going to really be digging, as Rob mentioned, we're not going to be digging too much into the past and doing a huge workup, although we do have some training, some fundamental trainings on assessment, but it's really, it's inviting this elaboration and deep thinking about issues. And these questions are being with how, why, tell me, or describe. For example, you know, I might ask, you know, tell me what brings you in here, even if you already said it to the doctor, and because I'm getting a new spin on it, a perspective, and the recovery is assumed. So the best part about the recovery process is as people respecting other members of the community that have substance use disorder, we are there to engage. Engagement equals recovery, and assuming recovery basically means, much like any other field, it's kind of like, I'm already seeing you as someone who's in recovery. You're in the hospital. You're here to get better. So I think that's huge. It just also helps to listen an open conversation about the patient's view of his or her problems and commitment to change. A lot of times, anything you can answer with a yes or no response, it kind of leaves for that dead air space. And again, Rob, wouldn't you say people are pretty guarded anyway, so if I'm not asking sometimes the right questions?
Yes, and like I touched on with open-ended questions, but, you know, it will be less about specifics to their consumption and asking questions like, what do you not like about the effects of alcohol on your life, and give me some examples. So that can keep the conversation going.
That's awesome, man. I think next, most importantly, in my book, not that I don't know, Susan, if my book counts, but
Sure it does.
it's not as good as the sobriety book. But anyways, affirmations
yesterday when we were doing a little dry run here, we were talking about, you know, one of the psychologies of unconditional positive regard. And that's the first thing that comes to mind for me. Right after we're asking them, you know, a recovery might feel like they're being riddled with questions. But immediately, like Rob talked about, you know, getting to the heart of the matter, it's kind of like, I'm going to immediately give them credit for their honesty, if nothing else, you know. And for example, if someone was telling me, you know, I'm so glad I'm here, you know, I've been screwing up, and I you know, and they might just feel so remorseful and so terrible, and it's just so indicative of the addictive thinking patterns. But immediately I will be like, you know, I just want to really, I want to thank you for letting me in on that secret, because you don't know me. And that can just be huge on more than just your initial lived experience and kind of just meeting people where they're at, is what we say in recovery coaching. It also is just, there's so much to that in healing, and beginning right there and just letting them know that you appreciate them.
And yes, so affirmations, just like I touched on in the previous slide. So getting to know a person, their history with recovery, and a lot of the times people will be engaging in some forms of treatment even though they're in the hospital, and we really have to build off of that and see what's missing and help to you know, better the recovery by acknowledging what they have been doing and what they're participating in, and how to build on that. And like I've said, it's you know, recovery is not an event. It's your life. If you have a substance use disorder, and people transition between contemplation, action, maintenance, you know, possibly relapse. So it's like very good to even acknowledge and give them kudos for any periods of sobriety that they had 10 years ago, and reflect on that.
That's a great segue, Rob. Reflections, you know, is just one way that this expresses empathy. It guides the patient towards change and resolving ambivalence. Reflective statements restate the patient's comments that capture the patient's communication. So this basically, when we reflect and restate what the patient said, maybe sometimes even in a different way, it speaks volumes to the fact that the person, they're for once they're being heard, you know, and the reflection there is that what they say matters, and they matter most importantly. We're going to kind of speed through this working with ambivalence today. We do just want to say that, you know, MI, it is a conversation about change. Most importantly for our job here, being a coach, really the backbone of it is that, you know, we're working with this strengths-based, we're working with their own commitment to change and motivation, and but also using self-direction.
Yeah, and like we've said, this is a hospital setting. We are approaching them from left field sometimes. Pre-contemplation, being guarded is a common thing. This is not a post-treatment engagement or them showing up specifically for substance use treatment a lot of the time.
I think developed discrepancy is one of the major pieces of MI that you hear when you go to the Recovery Coach Academy. This is, most importantly, the last script here is using MI is helping patients become aware of how their current behaviors are leading them away from their goals and values. And that is really, that's recovery wellness planning that we're also doing in the community. When you develop these concrete objectives and goals, you know, it kind of helps to establish, like, so, for example, so-and-so may want to do this, but your continued drug use is really not affecting that, and it's not contributing to your overall wellness. How, you know, that can be just a very powerful tool, a pivot point, which will help tip that decisional balance for people to get into recovery. And what a beautiful process it is. So what's the overall here?
MI is not easy. It takes a great deal of patience and practice. There are many resources available, both print and online utilization. And again, like we've touched on, and our feelings about MI, great tool, great education tool for everyone at any in any arena. Thank you, Rich. To engage with patients, especially patients or people with substance use history. But us being recovery coaches, people with lived experience, I've found, for me personally, it's very easy for me to talk to anybody in this hospital at any stage of change to make some form of connection and understanding of who they are, how I could help, and explaining my services, and building from there.
Yeah, and I think stylistically, you can really become a master of it. But one of the things you learn in Recovery Coach Academy is treating people as a resource. So when you get to that, all the good questions in the world, you know, is most of all, if I'm authentic in my approach of treating them just like a person as they are, instead of talking to them, or at them rather, and talking to them and listening, and like I said, developing these skills as you go on. We want to really get into the intervention that we have here, and I think this is probably what many of you signed on for this for, is to really understand kind of what we've accomplished here and what we're doing here in the hospital. Rob, do you want to explain the intervention?
Yeah, so obviously this is fairly new if you call 2 years of a grant new, but realistically it took a while in this huge organization that is this hospital that sees a number of patients to establish what our roles are with the addiction psychiatrists, addiction social workers, and recovery coaches. We really look at the addictions team, as we call it, as a unit that all play their own individual parts. And don't get too hung up on this graph. The slide, it does not represent how everything goes perfectly. But we do, at some point, get a referral, whether it's an attending physician or a social worker that has identified someone with a substance use disorder. And we have promoted through our time in the hospital, no matter who they are or what level of change they are, or, you know, regardless of motivation, to contact us so we can see what we can do and make a touch and engagement, and you know, follow up with our engagement, possibly to assess if the social worker needs to step in, or addiction psychiatrist, and the addiction psychiatrist will play their role, whether with you know, administering medication-assisted treatment. Social workers will set up official referrals to outpatient services and medication, and we are just one big flowing working team inside the hospital, always adapting, always taking on new challenges and learning. So,
yeah, definitely want to give a shout out to UMass as a system of care. It's the best place to give and get care. One of the things that it's such an honor to watch this field come full circle and have it really build up, because we do get to document these things, and we are part of what we call a multidisciplinary team. And so we're just another cog in the wheel, you know, so to speak, and happy to come at it from this angle. So the next couple of slides are just, we'll kind of give you a brief, very brief these are our success stories. A lot of times I think the biggest thing, and I know Rob would agree, is that people, we're like reductionists. We love to only see the bad, or what doesn't happen, or can you guarantee these people will be sober? Mm-hmm. But I think anybody would agree that one life is worth saving. Mm-hmm. And so some of our biggest success stories, Rob, if you want to share yours,
yeah.
Then I'll...
And we'll also touch on, you know, what is a success in the hospital, which is close to impossible to engage. Count when it comes to our engagement. So Jason is a 32-year-old male, and he was in the hospital for a period of time, several months. During this admission, I worked with Jason weekly. You know, he was very happy to work with me and talk with me about, you know, his history of substance use. While in the hospital, he had been sent to a place for IV antibiotics, which is actually a common theme with all the blood infections and other various infections, and it's a great point of intervention, which needs to be developed on in the medical field, to have someone that maybe was not interested in treatment, but then has this great opportunity to be intervened on and have a structured, stable environment to get sober. So sent to a nursing facility where I continue to work with him and develop a recovery plan. Jason really was motivated to get his license, figure out where he's living after this whole situation, come with me to some 12-step support groups that he engaged with, and to you know, continue his participation with his medicated-assisted treatment, that I would you know, accompany him to his appointments. And that's another huge key tool that we did not develop until somewhat late into the hospital experience, is the ability to transport, some legalities and whatnot, but great, huge tool to engage with someone and explain that anything that supports your recovery, I can facilitate transportation to. And then Jason went on to further, you know, try to work out some custody dealings with his daughter that I advocated for him. Not, and in hindsight, a letter is fine material for someone that is presenting in front of the judge, because you know, court dates can get messed up, and time is important. But basically, it's like Rich said, I cannot guarantee what is or isn't with a patient at any given time because of their interactions with me, but I can explain and advocating for someone what I am, what I do, what we've done, and how I am a continuing support. So at no point did I ever say in some kind of custody battle for his daughter that I can guarantee he's sober, or he's going to be a good father, or this, that, and the other, but just saying that I explain my services and the recovery participates in the services.
Awesome, Rob. Thank you so much for explaining that. I know so many times just being in recovery, you can feel so alone, and just having somebody to, you know, to just be there. A lot of times being a coach is just being there, where many people don't have anybody. We're going to skip over Matthew.
Yes, they can read about that.
Yeah, I appreciate the patience by anybody here listening today. This is a loaded topic and discussion.
I could have spent 30 minutes talking about Matthew, and
really that's what we want to do.
And if you see at the end, you know, that if you read this story, he ends up leaving treatment, and I have not been engaging with Matthew in the past several weeks, but you know, it's a huge success taking someone that was on this path of continuous use with really, you know, in his eyes, no hope, and having medical issues, to be in the hospital and having me intervene and trying to help him, and you know, lots of different angles and stories I can talk about with Matthew, but reducing stigma in the hospital, supporting his recovery plan, and having something happen that, if we did not, you know, have me there or him with an open mind, you know, a lot of this would have not happened at that time.
Yeah. And quickly, Rob, thank you so much. And I can just, you know, these faces pop up in my mind that, you know, these are just, you know, these are basically peers of ours that we're so happy to be able to help. I have a guy, I'm very happy to report that we have a thing called, in the state of Massachusetts, called SUD evaluations, where it basically determines after an overdose if the person has been seen. And we just want to give another, once again, another shout out to Massachusetts. We live in a very progressive state that, you know, that makes sure that they're identifying these SUDs. So the cool part about, I'm happy to share about this patient, is that this was one of our jobs it's kind of a secondary workflow. But I called the guy, and whether you want to call it a right place at the right time, but I called him, and he continued to meet with me for many months. We met about 8 times before I helped integrate him into his preferred 12-step method of Alcoholics Anonymous. I took him to Narcan training, was one of the many things we did. We went to the RMV together, and one of his goals was to get his driver's license. He did get that back. See, this is really the heart and soul of recovery coaching, because here's a guy, had he not been Narcaned, Rob's our Narcan champ here, delivering it to patients here at this campus, and I deliver at Memorial, is that if he was not Narcan, if I was not Narcan, you know, spreading this message of hope that we see at the top here. Here's a guy who now has started a website for people in recovery, and also, in addition to that, takes other people to become Narcan trained. And, you know, I could just, you know, I get worked up about it because, you know, for all the sad stories, there's some amazing, amazing, tremendous stories of hope. And I do continue to see this person that I admire his recovery daily. So just to kind of sum up, we do in-house and community recovery. So we do bedside engagements. And Rob,
So yeah, I know we didn't touch on us specifically. So basically, as a recovery coach in the hospital, any patients with any kind of substance use history or substance use related admission potentially can get a referral to us, and we meet them. I explain who I am, how I'm a peer, and I really just try to navigate in the hospital how to best receive some resources or a plan of treatment, because it can be so complicated. We could have done this webinar for 3 hours, honestly, talking about different medical complications that can change a recovery plan. And in my experience within the hospital, besides my lived experience, to best navigate that patient through the hospital, what a recovery plan is, and then to really emphasize that after you leave the hospital is when our engagement really soars, and I can work with you in removing more barriers and continuing with that recovery plan, because like we said, recovery is not an event, it's a lifestyle that it takes many days, many 24 hours to develop, and we are always developing. So
absolutely, you know, and basically, like Rob said, that is the heart and soul of the time, but really getting out there, it can be tricky navigating it, but we're happy to do it. And ultimately the goal is to get into the community to work with these individuals. One of the big things we're asked about is how do you measure success? I know, for example, from me, one of the best things I'm able to do is to have working relationships with doctors and many other professionals. Being a recovery coach, it is part of my job description to be an admitted former drug user. And so now people ask, though, you know, Rich, and they ask the same questions to Rob, you know, how do you measure this stuff? Well, we're happy to tell you that we did have some people, we're not supermen, we did have some people backing us up. I want to give a shout out to Steve Higgins and Colette and so many others that helped us get this research together. And also want to thank Timothy Alibozic for helping us. We have a software called the PAVE, which basically determines the substance users that are in the hospital.
Yep. And this reflects a team, not just us as recovery coaches. So
we want to say that. Oh, sorry, Rob.
No, I was just clarifying that.
Thank you so much. It is difficult, again, to bring this up to speed, but basically we did recently receive another year and 3-month grant for that ED bridging we mentioned earlier. But we will tell you that after good statistics and good researchers, we did see over 1,000 patients in 1 year. We brought this whole package. We want to also thank Kathy Beauvais for kind of being really, you know, getting in there with psychiatry to have these interventions. We did have proactive consultation models initially, but then we made Susan, I think you'll be happy to know, we formed such good relationships. We no longer are, we're actually scaling back proactivity. Wow. Because we have working relationships with social workers. And 10% of the patients engage in post-discharge recovery coaching, which, as you know, 10 is better than none. Yep. And here's a quick kind of graph about people engaged in treatment and what's going on with their 30 days post-discharge. And again, we don't know if the numbers are reflected seasonally, but we can tell you that it's looking better than it was without the help of a coach and a team of addiction psychiatry and social workers.
Great.
So this is just you know, one of those things that can really brighten your spirits, because like we said, how do we measure success in the hospital? There's a term that Rich loves to use, the 40th person. It really takes a lifetime of experiences to get to a point of motivation of sobriety. This text message and picture of someone I've engaged with in the hospital with 9 months sobriety was a real lifter for me. I did not have communication with him after he had left the state to continue on his journey, but while in the hospital for a week, he was very engaged with me, very happy with me, and working with him. He was actively using then, had some history with treatment, and had a sad story of siblings that have passed from this terrible disease. And to have him reach out and give me you know, a little insight on what he's doing, even though while in the hospital, it was not in detail of getting on medication. There was not much detail about, you know, post-discharge programs he's signing up with. He did have a recovery plan to get back into treatment, but, you know, here it is, and hopefully many others like it.
Right. The proof is in the text, you know, and I can say that I can join Rob and also our other coworker, Teresa Phelan. We all have many experiences of sometimes they're, you know, hopeless and dismal, but if nothing else, we're a huge vocal voice and we're a seed planting, and sometimes you get these excellent, excellent results, which continue the work. And we're so happy to say that with the help of many others like Susan and others here in the system of care of the hospital, that we are changing minds and changing hearts.
Yeah, so besides our interactions with the patients, which is a big key goal, being a recovery coach in any setting has so many other benefits besides the, you know, the patient's experience here and how we can help, but just the culture overall in any setting, whether it's going to be a jail, police force, in the hospital. There is a level of stigma that is with the best of us, and to be that face to show that recovery is possible, that's the biggest thing for me as a recovery coach, a person with lived experience too, that you know, self-identifies, is to bring a face to these places that sick and suffering person has hope and a possibility, and to just, you know, brighten everyone's day and give insight about what is possible and how we can all get well.
Right. Yep, so you guys are changing the culture, and hopefully, you know, by educating people, the stigma is going to be less and more people will feel freer to get into treatment. So anyway,
Amen.
We'd like to have you guys type some questions in, if you have some, into the chat box. And while you're doing that, in the interest of time, maybe I'll just talk about the next webinar. So on November 28th, we actually have Franklin Cook, who is a clinician, who's going to present information about understanding grief after an overdose death or a suicide, and how grief due to those circumstances is different than grief in other circumstances. All right, and all right, and there is an evaluation link here if you're going to get MLA credit. The enrollment code is on the slide, and I will put the link into the chat box for you. And I'm not seeing any questions just yet.
Come on.
Sorry, guys.
I was really looking forward to that.
Here, hold on.
Do want to thank all the attendees, though, people that took their time to share their time with us. And
yeah, and again, another shout out. Rich pointed out to Kathy Boulvert, the originator of developing this grant and having a vision of it, working alongside with Dr. Brown, and giving us this opportunity.
All right, so I am seeing some questions now, and I will put that link, I'll work on putting that link in. If I don't get it in right now, I'll email it to you guys. So I see, can you here we go. All right, so what are the qualities that make up a good recovery coach?
I think we got one before that.
Oh, sorry. Can you bring it up?
Let's, from the top.
So we do have Actually, if you look at the slide about the graphic novels, there is a book that we have called Sobriety. It's a graphic novel, and that would be one we would recommend. Okay, the next question is...
I'll be happy to bring that to you, Mark. Actually, a colleague and friend works at a place here in the city, so that would be awesome. I can show him that book.
Yep, all right. So what are the qualities that make up a good recovery coach?
So to touch on that, well, when it comes to the training, there's a 5-day training that follows up with some other in-person trainings to become a certified recovery coach. But what really makes a good recovery coach, and to define, you know, because a 5-day training, what is that? It's a person's lived experience. What kind of levels of treatment have you been exposed to? Life situations like Rich touched on. I had been immersed in the legal system, treatment facilities, participating in all levels of care. During my own journey of recovery, I participated in treatment while incarcerated. After getting out of that incarceration with a year of sobriety, I participated in living in a halfway house, social models, and from there, just engaging in all levels, really, you know, having an understanding of 12-step programs, and living, you know, for me, I have not had a substance, mood or mind-altering substance for 6 years, and when I applied for this job, I had 2.5 years sober. So if you were an organization looking to hire someone, having 2 years of more of sobriety would always be a good marker, besides all the other lived experience besides the actual training for a recovery coach.
And I know we're short on time here, but just to kind of, I think one big word comes to mind is heart. Is anybody working in this field, I know, coming into the recovery process, just to kind of bridge the gap and where the rubber meets the road of being in recovery and becoming a recovery coach. I know it wasn't until I was doing this for a while. It wasn't right when I felt like, oh, I like to help people. Many people, you know, we never helped ourselves, but we love to help others. But it's really kind of continuing to practice good self-care, and, you know, the quality is really, like Rob said, just, you know, having so many experiences that are like a robust things that will help many of the people you're going to work with.
Yeah.
Definitely don't want, it's a peer, not someone who's in a different position, who went to the training, and they may have lived experience, but, you know, it's good for them to have the valuable information, but it's really important that you've been through this stuff.
Yeah,
and it's really the credential.
And like I touched on, before any kind of professional employment, I managed a young adult halfway house for two years, and you know, that exposure to the field and being reliable and working with others was a huge you know, shifting point for me in my career goal.
All right, and our other question is, many substance users are employed. Oh, I'm sorry, what is your advice? You guys kind of touched on that.
Yeah, I'll just say one thing, Susan, is that check these things out. They're online. You can go to Careers of Substance. You can go to the New England Institute of Addiction Studies that happens every summer, as well as throughout the state, people having the Recovery Coach Academy. But there are some continuing qualifications and educational groups that you have to attend to get that certification.
And is it a state-by-state thing? Because we do have people from other states.
Yeah, actually, it's good that you asked that.
You could do a number of things. Massachusetts has developed their own certifications. You could do an online course to have some kind of certificate. It all depends on who you're working for and what they want as a level of credentialing. But Massachusetts has set a bar for what we would like to see.
All right. So while I'm getting the evaluation link in the chat box, can you guys answer the last question? Many substance users are employed. How do you help a person continue to stay in their job while going through the beginnings of the recovery process?
I think it's important to not be, you know, we never hear this a lot in recovery rooms too, but it's like we don't beat ourselves up with a feather, you know, to kind of grab something from a meeting, you know, is just to kind of remember that it doesn't spell failure. this is not a character issue. If you could just scroll down there, Susan, I kind of just want to be able to see the whole question.
It's hard for me to do it at this angle here. Can you do that? I'm sorry.
Thank you for your patience. One thing I would say is that when you're in the beginning of the recovery process, like Rob said, it really is. It's a process and not an event. So basically, you need to just continue to meet with people, recovery coaches, people that are going to help support your overall recovery, other friends, family members, be it a 12-step room, a sponsor. The question is, I guess, for me, I don't have any experience with it, and that's really as much as I could say about, using while being employed, but how to stay in their job. So, Rob, maybe you could wrap that up.
Yeah, it's a question that, of course we engage with people that either are employed, trying to keep their job. A lot of the times that topic comes up when we're talking about an inpatient level of care, and they touch on their job and wanting to keep their job or any other kind of things going on in their life besides a substance use disorder. So it really depends on the individual in helping them keep their job. Specifically would be touching on all the other recovery aspects they can participate in after discharge. So if someone was, for me, I approach, obviously everyone's recovery plan is different, but I always approach, if you want the best results, you'll get, you'll jump into recovery, head first. And, so a lot of times that will be talking about inpatient levels of care. So sometimes I'm talking to someone about weighing the risk and reward of going inpatient or keeping their job, because in my opinion, how are you going to keep your job if you can't stay sober or alive in some cases? But if hell-bent on keeping their job, living their life, I would recommend participating in other 12-step programs, whatever medication they possibly might have signed up for.
Whatever pathway you embrace.
Whatever pathway, but, hitting that hard as best as possible.
All right, and we have one more question. I know we're a few minutes over, but is there a specific substance that is extremely challenging to recover from, and why?
Well, I guess, I'll speak from experience, and I know one of the most powerful holds that cocaine can have, and to kind of coincide with that is methamphetamine, from the damage I've seen personally and have read about and have kind of learned about in school, the way it captures the brain and the way it interacts in the mind. Mm-hmm. It's very, the euphoria produced and recalling that, and people who have probably had the most time staying stopped from it. I have heard of methamphetamine. And for me personally, it was heroin, but through the help of my employment and recovery rooms and friends like Rob / coworkers, I'm able to do so, and we're lucky to be here.
I'd like to say I can read that question in so many different ways, because to recover from, are we talking, physically? Obviously, in the hospital setting, we see a number of different medical complications from either IV use or, like Rich said, psychologically from substances, and you'd really have to dive into the specific substances. For someone like me, I look at all of it the same mentally, because this is a mental illness. The way I look at substances and how I try to use in safety. It's 2018. There's a lot of complication when it comes to substance use and the variety of substances to use, and trying to get an understanding of an individual's perception of what is harmful to them and what is not. Like I said, I could really read that question in many different ways and touch on that. But for me, like I said, at a certain point in my recovery, I look at every substance the same when it comes to a desire to drink or drug. And again, like we've said, being a recovery coach and engaging with a patient that's is sick physically, mentally, spiritually, it is a huge gift to look them in the eyes and say that it can be different, and recovery is possible. And for speaking for myself, I've not had a desire to use a drink or a drug for several years, and I'm no one special just because I work in this hospital with a badge and have some experience. There's many friends of mine in recovery that lay pavement and at certain times can work a better program than me. And you don't have to be a recovery coach. You don't have to do exactly what I did. But working a program and finding something to save you from this thing is very important.
Great. All right. Thank you, Rob and Rich, and thank you all for joining us this afternoon.
Have a great day.